This conference
so
will now be recorded.
so that we can so that if you wanted to go back in the future and review this application process, you can. At the end of it, it should take about 20 minutes to kind of go through the e-app start to finish. After that, we'll kind of open it up for questions. You can also type into the message box if you wanted to message in quotes, or I'm sorry, questions. And we'll also unmute everybody at the end of the call so they can ask voice questions as well. But everybody should be able to see my screen, and this is going to be the main page that you get back into, or that you get logged into from the MHC agent website to get in to start running a quote and doing an application. And so this is kind of the main dashboard page or home page of that tool. To get started on doing a quote, you just go ahead and click Run Quote under Medicare Supplement. And I've preloaded the screens here, so you're going to see me jump from screen to screen, but that's just for congruency's sake and to making sure everything flows smoothly. So you'll click Run Quote, and it's going to bring up a page that's going to look like this. And this is our demographics page. This is where you'll type in the zip code, age, gender, tobacco status, and plan that you wanted to run. And that's needed to run an accurate quote. So we need those 5 pieces to be able to run an accurate quote for you. And you can type in any zip code here. I use this Billings, Montana zip code. Any age, both genders, either tobacco status, and whatever plan you wanted to run or that's offered by this new MHC Medicare Supplement option. So after you type in those credentials, it will pull back the current county that zip code resides in and the city and state that company or that zip code resides in. And you're going to press Get Quote. That will then populate a screen that looks like this with the results. On this page, you can do a number of things. One is you can obviously see the quote per month, which is $107.74 for this individual. We also provide what the household discount percentage would be, and we'll get to that here in a second as we do the app, and the $25 policy fee. This fee is not included in this price because it's not a part of the premium that they would pay. We're just labeling the $25. But we did not include that in the monthly premium because, again, it's just a one-time fee or cost. We also have the plan details button here. So if you wanted to see the benefits associated with these plans, you can click the plan details button, and it'll give you the cost breakdowns for all the different benefits that come with this Medsup plan, the services broken down by category, what Medicare pays, what this plan pays, whether it being G, N, F, and so forth, and then what the consumer would pay associated with the plan that you made the selection for. So this will update as you switch plans. And to switch options, you'll do that up here using this quick quote section. So rather than having to click back and forth from that main demographics page and this page, you can just make changes right here on this page. You don't have to keep going back and forth between pages. So if I wanted to run a different age, I could. If I wanted to run a different tobacco status, I could right here. However, if I do want to run brand new and fresh, I can click this new button up here in the top right-hand corner, and that allows me to start from the very beginning. So we allow kind of both options there. But after you've run the quote, you see the $107.74 per month. Your beneficiary wants to go ahead and enroll in this plan. You would then click Apply Now. And what it's going to do is it's going to now put you into the application portion of the tool. So we've done the quote. By clicking Apply Now, we're now doing the application, and the first page of that application is to select the underwriting situation. And we've done a number of different things here on this page. The first is it's going to have your agent information in here, your name and your agent writing or your agent number or NPN. Obviously, this is a test account, and I'm not a live agent, so my information is going to say none, but this will populate with your information here. As well, it's going to carry over the rate, the gender I was using, the age quoted, and the tobacco status. So it's carrying over that information from the quote, as well as any of the initial documents that I want to provide. So we have the outline of coverage, we have the guide to healthcare, terms and disclosures, and just the paper application that you can click and print. Or if you'd rather email this to the beneficiary, say you're doing this over the phone, you can click Send by Email, type in their email address, and click Send Documents, and it can send all those documents directly to the applicant in their email inbox. So that's going to be what carries over from the initial page. But on this first selection, we have to select our underwriting situation. And that's either going to be fully underwritten, open enrollment, or guaranteed issue. If they click this info icon here, it's going to populate some definitions of what we mean by those different underwriting selections. Because all the business logic is built into the tool, you can't make an incorrect selection. So for example, if I was to select guaranteed issue and we going through the process of entering the information on the app, the system determines maybe they're 71 years old and they've had Part B for 6 years. This is not a guaranteed issue situation. It will have you come back here and select fully underwritten, and vice versa. If you were to select fully underwritten and they just turned 65, that's actually a guaranteed issue or open enrollment policy. It'll have you come back here and select guaranteed issue or open enrollment. So the system, all the business logic's built into this tool, so you, the agent, cannot submit this app that's not in good standing. That's kind of a good fail-safe to making sure that the app is submitted as under the correct criteria. So you're going to make those selections here, and as a part of that, it's going to carry over the birth date of that individual, and you're going to begin to type in their Medicare Part A and Part B effective dates. So that's that main screen here under Select Underwriting Situation, and really the first step to completing the app. After doing that, you're going to press Continue, and it's now going to put us into the full application. So now we're into the full application. We'll begin to enter in applicant information, and you can see here we now have a status bar that's been opened up to us. On this status bar, it's going to give you the different selections that you're going to need to make, or the different headings for the different pages of each app. You don't have to complete these in order. If you wanted to jump around, say I want to do the physician information first, then I want to go to health information, then Medicare information, you can jump around if need be, or you can work it in this order. That's completely up to you. We provide on the status bar a green checkbox if everything's completed and done, or a yellow exclamation point if there's an issue with what was entered. Maybe you missed an answer, maybe something's not typed in right. Whatever that case may be, it'll provide you an exclamation point, and if you have one of those, it won't let you submit the app. Again, that goes back to the business logic associated with enrolling on this platform. If something's missing, it won't let you submit it. So the first page here is going to be applicant information. This is you type in the first, middle, and last name, resident address, their home phone, height and weight, some basic personal information about that beneficiary. And that, again, that's the applicant information page. Also, too, this will match the paper apps. So if you have a paper app that you've seen or that you planned on using, all this information will match the exact wording on that. So this isn't going to be different than what that paper app would be. So after we fill out this applicant information here, we'll click Continue. It'll then move us into Medicare information. This is you'll type in their Medicare number, Social Security number. It'll carry over their Part A and Part B effective dates, and making sure if they're applying during their open enrollment period. And so that's the Medicare information, just some basic level beneficiary information on their Medicare. We could click Continue. It'll move us into previous or existing coverage. Obviously, if it's a guaranteed issue policy because they're brand new to Medicare or they haven't had a previous existing policy, the answer to this would be no. Say they previously have plans or insured with somebody else. The answer may be yes, according to some of these, and you begin to, and it'll ask you additional questions if you start answering yes. So if you answer no, it'll let you continue. If you answer yes, it'll ask follow-up questions as to why you're answering yes. And so depending on how answers are made, additional questions may be asked. And that's, again, just based upon the system double-checking and making sure that the app is done in proper form. So after you would fill out this previous or existing coverage information, we'll move over into health information. This piece, these health information, health history, method of payment, drug information, all of that would be skipped in the event that you were doing an open enrollment or guaranteed issue. Because I selected fully underwritten for this demo purpose, because I wanted to show you this health information, it will provide a response to making sure that you're filling out all the health questions. This will be skipped if you selected open enrollment. And so you do not have to fill out these questions. It'll just, this section will be blank. You won't have to click on it. But this is where you enter health information. If I was to answer yes to a couple of these questions, and that's going to decline my individual, it will provide you a notification here that lets you know, hey, because you answered yes to leukemia, based upon our underwriting rules, this person or individual may be declined. So it's going to warn you as the agent before that gets submitted in that because of certain questions, the way they were answered, yes, you answered them in full, but because of how they were answered, it might get kicked back out. And that way you can communicate to the beneficiary that, yes, we've submitted the app, but because of X, Y, and Z underwriting rules, they're telling me that it may not be issued. And that just is a helpful tool for you to use as the agent that gives them instant response to the beneficiary. So that's the health information. We can then move over into health history. Again, just some additional follow-up information if they've been hospitalized or if they've been prescribing prescription drugs. If yes, you would then enter in the drugs. This works just like the same way that the health information would. If you enter in a drug that would be declinable and they're outside their open enrollment or guaranteed issue period, it's going to provide you that notification, but because, hey, if you take Procrit, which is for kidney, that's a declinable drug. We're warning you before you submit this, that's going to be declinable. If you're in your open enrollment or guaranteed issue, you would skip this process. The app would not have you ask these questions because it's guaranteed issue. So that's the health information there. Moving over into physician information. This is where you would type in the primary physician and office information of that physician. Additionally, if they have seen specialists, maybe they're seeing a back specialist or a chiropractor or what have you, this is where you enter in specialists. This is not required. You don't have to enter in specialists if they're not seeing one, but if they are, you would need to enter it and add these specialists in. You can also add additional physicians. If they're seeing multiple physicians, you can click yes and begin to enter in those additional physicians if need be. In regards to the zip code and city and state, you just need to type in the zip code. It'll pull back the corresponding area that this zip code is in. It'll pre-populate the search, and it'll allow you to then you don't have to type in the city and state. It'll pre-populate that based upon the zip you would enter. So that's the physician information. We'll move over into method of payment. And this will follow whatever method of payments that are currently offered for MHC. So, for example, if they wanted to do check or automatic bank withdrawal, they can. If they wanted to select when they draft the initial premium, say they wanted to do direct bill or automatic bank withdrawal. If automatic bank withdrawal or direct bill, they can select the frequency they would want those withdrawn on, checking or savings account, and you can begin to then enter the routing numbers associated with the bank. As you start to enter the numbers, it will populate different banks associated with the numbers you typed in. So you don't have to type in the full number. You select the institution, the account number, and the name shown on the account, and that way it can be submitted. So all the different banking information that would need to be entered with the app, you can do so here right on this page. Additionally, if the account owner say this policy is being paid for by somebody outside the beneficiary, that is also available here by selecting yes or no according to that question. And so, again, we'll follow whatever method of payment MHC currently offers, and you can be able to select how they want to pay that and the frequency of those payments. So that's the method of payment section. The last section here before we review this app is for the producer or you guys yourselves, and that's to be completed by a producer. This is where you'll enter in certain information about yourself. It will also ask you questions that you certify you interviewed the applicant. You are confirming that this is accurately recorded by the applicant themselves. My phone number and contact information as the producer, and I'll go ahead and attach any documents I want to the underwriter. Maybe they're coming off their group coverage. That's a ticket to get a good guaranteed issue. If you want to attach other documents to the underwriter, you'll do so here on this to be completed by producer page. That will be the last section for the app. Moving forward, the next page before we submit this for signature is going to be this review and lock. What this review and lock does is it allows you as the agent or the beneficiary, if you're doing this with them, to review the application. And what this allows you to do is see the entire app on the screen to making sure everything's done and in good standing. So if it's complete, it'll say complete and all my answers. If it's incomplete, it'll say incomplete, and I can go back and edit. Click here to edit this section. Maybe there's something in there that isn't answered correctly, or maybe we skipped a question and we need to go back and review what question we skipped. You can click this edit button here to go back and do so, or you can just click here on the right hand side to move the sections associated with that exclamation point. And again, we're showing you those here of the sections that needed to be fully complete. But say this was completely complete, everything was green, we've reviewed everything and it's all answered correctly. We can print this for signature. So if you wanted to go ahead and print this for a wet sign, so the applicant was going to do it in person and we're just going to sign the app, you can just click print for signature. It gives you a fillable PDF that you can download and print it, just have them wet sign. Or we can do electronic signature. We would press this lock and e-sign. It would not let you lock and e-sign it if you still have incomplete messages. And again, that goes back to making sure that you, the agent, don't accidentally miss something in doing the app. So we click lock and e-sign. It's going to move you into the consent page. And so this has all the terms and disclosures associated with this product and application process. Here's all the terms and jurisdictions and licensing stuff. You would click consent as I agree and press continue. It would then bring you for the statement of signature where we can submit this for a signature. If you're in the same location as the client and you wanted to go ahead and submit this as the applicant, they can click apply signature. They type in their mother's maiden name and last four of the SOS to validate it, and you can sign this right away. If you'd rather send this through email to have them sign it, they're not in the same area or the same location as you are, and you want to send this app through an email, you can do so here as well to be able to do that. And that'll be a button here that'll say send email. Type in the email address and it sends it over. This will also, you're typing your producer name and your MPN to validate that, making sure that you as the agent are the agent of record on this app. So that's completing the application and getting it complete. There are a couple of different things that I'll show you. The first is after you've submitted this for signature or after it's been signed and submitted into the company, you can go to see the status reports of the apps that you've done. And how you do that is if you remember this main screen here, there's a button that says View Applications. So you click View Active and it's going to populate a screen that looks like this. And this is essentially giving me a status report of all the apps that I've done that I can search by either first or last name or both. That would then allow me to give to search for the app that I've completed, that it's incomplete, that it's pending. And what this status will say is if it's saying incomplete, that means there's still sections that I've done, or maybe I started to complete the app, I had to leave and come back and finish it again. If you click out of the system will automatically save this here, and you can go back and edit this app. So if I click edit, it'll push me back into that app and allow me to continue on with completing that app. If it's pending signature, it'll say pending signature. If it's been submitted and approved, it'll say approved, and it'll give you a policy fee or a policy number. You can do all of that here. This is kind of the status or document page of all the applications that you've been submitted or pending and who they are for. And again, you get that by clicking this View Applications button here associated with this main page. By extension, we also have a couple of different things. Every one of you will have your own account. If you want to edit that account, say you want to change your password, you want to update your name, your phone number, what have you, you would click that My Account button up here in the top right-hand corner, and this will allow you to edit that information. The button to the next of that is Contact Support. This Contact Support button will allow you to submit a support ticket. So say you're getting an error message, you're getting some type of question on the app, you have questions on, I can't get into my account, or I'm trying to run this quote and it doesn't look right to me. Whatever the question may be, you can click this Contact Support here, and you can submit a message in, a support ticket, to get that answered. And that gets answered very quickly. And so that just allows you as the agent, if you get stuck or you have questions or anything at all, you can click this Contact Support button here, and that allows you to properly properly go back and get those questions answered. Also, another thing I'll mention before we open it up for questions here, this is mobile friendly. So if you wanted to do this, say through your iPad, you can access this anywhere there's an internet connection. So you don't have to have it on your special computer. If you got a new computer, there's nothing you download to that. There's no information associated with any credentials or VPN that you have to authenticate with. Anywhere you have an internet connection, you can get onto this, and it will conform to mobile devices. I probably wouldn't recommend doing an app on a phone. You could if you wanted to, but it would be cumbersome. But certainly an iPad or a tablet, if you prefer to use that and not lug around your laptop or your computer, that's also available. And so with that, I'll kind of answer some questions, and I'll kind of open it up, the phone lines, but I'll kind of go through some of these questions first. And I'll answer the ones that I can, and then I'll have Jeff answer some of them that I can't. In regards to the app fee, is it a monthly fee or a one-time charge? The app fee is just a one-time fee. It's not a monthly charge, and so it's not included in the monthly rate. It's just a one-time fee as a part of the app. One question is what are the dates given for the auto monthly withdrawal? And I'll go back here to the method of payment page. Here are the dates, and so if you do automatic bank withdrawal, you would select the date that you'd want that withdrawn. So say you want it drawn on the 15th of every month, you would select 15. If you want it withdrawn on the 10th of every month, you would select 10. That would be up to your beneficiary of which date they would want that selected. Another question here, physician info is only required for fully underwritten. The physician information will be required for any underwritten or any application case. What gets skipped for GI or for open enrollment is the health information and drugs. So that's what wouldn't be required if they were in their GI or underwritten case. Jeff, I'll kind of open this up to you. So I'll kind of unmute everybody now. Just as a note, if you aren't muted, go ahead and mute yourself just so if people have questions, they can hear the responses. So unmute everybody now. And then Jeff, a couple of questions that we had. One was, does this product have an AM Best rating yet? I'm not aware that you guys are currently AM Best rated. Is that accurate?
Yeah, that's my understanding as well.
Okay. Another question we got is why the app fee? What are you using this for? Is it approved by the Idaho DOI or DOI?
So anything we're doing has been approved by both states. The app fee, again, is charged. However, if someone is declined, the app fee is returned, as well as if they change their mind during the free look period, it will be returned. So it is refunded in those two instances. Other than that, it is charged. I know in other companies and instances, and I know Brian, you could communicate on this as well. It's not uncommon to have an app fee, even with some other companies. So that's what we have established.
Yes, it's not uncommon to have an app fee. Many other carriers across the country currently do that. A couple other questions for you, Jeff. One is expected underwriting time, assuming no additional questions are required, and is it instant on the GI cases?
I can get more clarification in terms of the time frame. In terms of the submittal, Brian, from your end with the process through, it's instant.
Yep, it goes directly in there. In regards to, they asked where they can find rate sheets or underwriting guides or health questions.
Yeah, so as I mentioned at the beginning of the call, we will be sending out next week an agent communication that we will provide some points of clarification, and then we'll also notify you that all the documents that you'll need will be on the broker homepage. So the hard copy applications, again, the E-App is the best method to submit an application, but the hard copy applications that mirror this E-App will be there, all the other policy documents, and then our intent also is to have the rates listed there, the link to the E-App, and every information there. So we will provide, again, that next week.
I have 2 questions.
Okay.
Why are you using the Social Security number instead of the Medicare number?
You would use both. And so it would ask the Social Security number and the Medicare number associated with that Medicare page.
Okay. The second question was regarding the contracting. I've received nothing that indicates that I have to sign a new contract.
Say that last one again, please.
I said I have not received anything, any correspondence indicating I need to sign a new contract.
Everything, and it's been sent multiple times to agents. If you're an appointed agent, every agent would have received an agent communication providing the contract that includes a revised agent contract. There was a slight adjustment increasing the commission for Montana individual and family policies that was effective April 1, and then the Medicare supplement commission. Again, bonus is not in there, but Medicare commission. Bonuses are subject to change because they're just a bonus, but we will be outlining that, letting you know next week. So if you've not received a contract, if you haven't, then email our agent email address, and that's agent, AGENT, info, INFO, at MHC.coop. And one of my staff members will get a contract sent out. Most agents have sent the contracts back and have signed. Again, if you've not done it, you will not get paid. So please do so if your office has not.
Thank you.
Thank you.
Jeff, another question we got in, and I'm not sure if I knew this one. Do you guys currently provide a discount for EFT?
I don't believe so.
Okay. Another question is will there be GI for Plan G? Yes, there's a guaranteed issue for any of the plans. And so one example is retirees coming off their employer plan, and this would be for people who have Part A and Part B for several years. If they are coming off their employer plan or that employer plan is getting terminated, they would be guaranteed issue. And you'll attach that notice of termination on there using this, using the to be completed by producer page. You'll attach that notice of termination here on the upload file.
And Brian, I wanted to add, and again, you'll get all this information. The 4 plans that we're offering are A, F, G, and N. So we're offering 4 plans, and as Brian said, you have different variances of, how the member can apply for that.
Yep. Another question is this tool here will run for the states that MHC is currently live in. I believe that's just Idaho and Montana at this point. So this will run Idaho and Montana quotes for that product.
Correct. So Idaho and Montana, as we go into other areas, and we will communicate and be set up with Medicare supplement time. But currently, yes, Montana and Idaho.
Okay. One question is, and Jeff, this is probably for you. You guys don't currently offer voice signature. Is there a plan to do voice signature in the future?
We haven't discussed it, but I will make a note of it.
Yeah, they can't offer that. I don't care what he said.
Okay. Another question here. If an E-App is launched from the producer's portal, can the producer information auto-populate on a future update? Yes, it will auto-populate. So this is just a test account. When you get your own account, your own information is all set up in there, all that information will auto-populate for you, so you don't have to type it in every time. Jeff, this is also a question for you. It says Exhibit A states commission is paid $180 for all years. They just want clarification on what all years means.
So I think you're referring to Montana, if that is in Montana. So that would mean for the life of the policy. If you look at the Idaho commission exhibit and the Montana commission exhibit, there can be some variances in terms of dollars and how those are paid. If it says life of the policy, then as long as the policy is in existence. The commission, the yearly dollar amount, of course, will be broke out in 12-month segments. And so it's paid as premiums paid. And commission will be paid as we're at the same time frame we're paying on our commercial side, individual, family, and group. So around the 25th of the month, you will get commission. And so any office that is selling Medsup and you've identified that, the information has been sent to our third-party administrator, Universal Fidelity Life Insurance Company. And so they will be paying the commission at the same time your other business is with the banking information you provided.
Another question we got, Jeff, is do the commissions change based upon amount of business written with MHC?
No, not at this time, but that's where the bonus comes in. We will outline this, subject to change, but this time we'll be paying a bonus for underwritten and open enrollment business in addition to that commission. So the bonus will be paid on your next commission statement in addition to your commissions owed.
Another question, Jeff, and you may know the answer to this and may not. Will MHC accept an app for somebody that does not have a Medicare number? And the example they gave is some people wait to the last minute. There are other companies that just allow the Social Security number to be entered in replacement of the Medicare ID, and it'll be issued at a later date. Do you know the answer to that?
I don't. So Brian, I would ask you the functionality of this E-app, will it allow it to be submitted without that number?
Not currently, no.
And so I'd have to, okay, so there's the answer on the E-app. In terms of a hard copy application, I'd have to answer the question to find out that if it would be accepted. So I don't have the answer to that at this point.
Okay. The question here. One question is no PC. What then? This is available through mobile devices as well. So if you don't use a PC, but you have a tablet, you can access this through the tablet. You would have to have some device that would be able to be connected to the internet in order to use this online enrollment. So whatever system you might have that has online enrollment would be available on there. Jeff, this might be a question for you. If someone selects direct bill, is there an additional billing fee for that? And does MHC currently accept credit card? I don't believe you guys accept credit card today.
No, not for this. In terms of the direct billing fee, I'll make a note of it. I'm not aware of any additional fee for that.
Okay. Another question is there a household discount for Idaho? I don't know off the top of my head. Jeff, you may know, but if the household discount is not available, it won't show. You will enter in as a part of this applicant information if there's an additional person enrolling with you, or if somebody's living with you based upon the rules for MHC. If that applicant is applicable for, let's say, that 7% or 5% discount, the rate will automatically adjust on the app. And so that's where you'll handle the household discount information.
Brian, my understanding for Montana, there is a household discount. For Idaho, I do not believe there is. My understanding is that most companies don't, and really you need to provide the best rate at the time. And so I believe there's not. But as Brian said, it won't populate if it's not available.
Right. Another question is if they have a client in Arizona or somewhere else, can they be put on this coverage? They would have to be a resident of the state you're submitting the app for. So if they weren't a resident of Idaho or Montana, they would not, at least at this point, until they expand into other states, they would not be able to enroll under this plan. Another question is, we got some insurance carriers will apply pre-existing conditions or waiting periods if they didn't have prior credible coverage. What is MHC's policy on this?
I'll have to verify with our TPA.
Okay. And then another question, what is the total commission paid for a Medsup app for the first 12 months?
So again, I'll refer you to the commission exhibit in your agent agreement. And so refer to that, and it'll outline for each state, and that's what it will pay, broke out in a monthly amount.
And we got this question on Tuesday. Someone had asked if there were silver sneakers or health club options, and Jeff, I believe the answer was no, not at this time.
No, not at this time. We are looking at it. I think you'll find when we provide, I think you'll find our rates are very competitive in both states. A lot of analysis went into it. We tried to do something with gym membership as our rollout. We were unable to, so we don't want to wait for rollout, but again, no guarantees. We are going to be looking at it in the future. Okay.
Another question is, if they don't have a primary care doctor, what then? You would enter in the last doctor they saw. So the last time that they saw a physician, that's the information that you would enter in for the last person that reviewed their medical records. And so we're getting some questions on household discounts in Idaho. If Idaho does not offer a household discount for Medsup, then MHC will not provide a household discount on there. So the system has already been programmed to handle all of those rules based upon DOI specifications. A lot of people asking, can we get a copy of the questions and answers along with the slides? Yes, so we're recording this, so you'll have documentation of all the different information associated with everything that's been answered or responded to on this platform. Jeff, someone was just asking who the TPA was, and that's Universal Fidelity is currently the TPA under this product.
Correct. So they're our partner with this Medicare supplement product on our applications, as well on the broker homepage, and then members will have the information on our webpage. There'll be the phone number for members to call to answer questions as they would need to. There's an address, phone number specific for MHC. And then again, you'll have the phone number as well if there's questions on commissions or applications, etc. As Brian mentioned, on this e-app, there is a help button, support button that you'll have to assist you in the process as well as you're completing the e-application.
Another question here. After the application's been submitted, Jeff, will there be a phone interview done by the admin with the applicant for underwritten applications?
And I think that will depend. I will make that question. I will take the note of that question as well. I think it depends on the situation or how questions are answered, but I'll make a note of this.
Okay. Another question we got is there any vision benefits associated with this product as an extra benefit?
No, there's not. Again, when you apply for this, you can bring up the list of benefits that are available, but I do not believe so.
Okay. Yeah, normally, most cases, a Medsup plan is not going to have vision benefits or dental benefits associated with it. Jeff, one question is they just want to know the website that this will be placed on?
So our broker homepage, so where you would be going today on our MHC website, you go to the broker homepage and we'll have all the information there. The recorded version of this training, the link to the E-APP site, hard copy applications, rates, everything there. So broker homepage as you go today.
Okay. We got another question in terms of resident state, and if they move, will they have to move their policy? So they would have to have a resident address in Idaho or Montana today to apply or keep their coverage. And so they would have to have they could have multiple addresses as long as one of those is in Idaho or Montana. That's all the questions that have been submitted. Again, everybody's unmuted, and if you muted yourself and want to ask a response, please unmute yourself, and we can also take questions over the phone as well. Just as I believe Jeff also mentioned on the phone before the call really got going, this will be active and live here starting June 1st. So you'll be able to get on here and do exactly what we did here on the demo starting June 1. Are there any other questions? Okay, Jeff, did you want to say anything in closing?
No, just to thank you for your time. We're very excited with this rollout. We think it's going to be a positive thing to the market. We came to the market competitive and just allows one other opportunity for members to stay with the health co-op, for you to keep them there and bring new membership in. So again, just excited to partner with you on this and look forward to more in the future.
Yep, and we'll be distributing this video so you can watch it again in the future in case you get stuck. And again, as Jeff mentioned, the contact support button is always going to be available when this gets live. And so I appreciate everybody's time. Everybody have a good holiday weekend, and we'll see you soon. Appreciate it.
Thank you.
Thanks.